I'm Ben Ryman, and this is Behavior Speak. In this conversation, Dr. Ashley Carrigan shares her journey into the field of behavior analysis, highlighting her personal experiences and professional aspirations. We explore Dr. Carrigan's dissertation research, where she evaluated the effectiveness of a telehealth parent training intervention that combined acceptance and commitment training, behavior parent training, and weekly coaching sessions to address selective eating in children. Dr. Carrigan emphasized the challenges she faced during her research, particularly during the COVID-19 pandemic, and the lessons learned throughout her academic career. Ashley also speaks about her current roles in education and community service, her passion for mentoring future behavior analysts, and her strategies for balancing work and family life. Thanks for being here, Ashley.
Thank you, Ben. It's good to see you.
Stoked. Before we get started, just want to acknowledge I am producing this podcast on the territories of the Klamath, Clayhouse, Humboldt, Comox, and Sechelt First Nations. As always, I'm grateful to be here. So, Dr. Ashley, tell me about yourself.
I am Dr. Ashley Carrigan. I'm born and raised in Georgia baby, and I have lived here almost my entire life, other than my grad studies. I spent some time outside of Georgia in California and Houston, Texas, and also in DC. But I landed back in Georgia primarily because that's where my family is, and we wanted, our kids to be around family. So, love Georgia, but definitely sometimes wish that I lived in other places depending on the weather.
So tell me a little bit about kind of how you got into the field in the first place, how you got into behavior analysis.
Good question. So I went to Georgia State University for my undergrad in psychology. And when I was finishing up my studies, I was contemplating about what I wanted to go into as far as graduate studies, because I already knew having a psychology degree was not going to get me pretty far. So I started looking at graduate schools and then also looking at what are my options. I knew I wanted to get into research because I wanted to pursue professorship, and landed on ABA primarily because I went in toward the Chicago School. Back then it was the Chicago School of Professional Psychology. Went in toward and was exposed to the different programs they offered, and then was exposed to ABA. And I kind of knew about ABA a little bit because of the Marcus Autism Center here in Georgia. But back then there was not really many ABA companies that, were hiring therapists at that time. There wasn't even such thing as RBTs back then. It was very, very competitive as far as getting in the position, and also it's a nonprofit, so not really much in pay. So I was like, I got to get a higher degree if I want to do anything. So ended up getting into school, moved to California, and started the ABA program. I actually started in that program before I even was a therapist. 2 weeks into the program is when I finally landed a ABA position at the Lobos Institute in Culver City, and then started working, in ABA. That was about almost 13 years ago.
Okay. So you said you wanted to do research and get a professorship. Tell me about that whole dream. Why was that the direction you wanted to go?
Yeah. Ooh. So,
do you have a certification with the International Behavior Analysis Organization, the Qualified Applied Behavior Analysis Credentialing Board, the Behavior Analyst Certification Board, or are certified through your region's Behavior Analyst Credentialing Board? You can earn continuing education units for this episode by going to www.behaviorspeak.com and clicking on CEUs. First secret word is broccoli.
Hi, everyone. I'm Dr. Ashley Carrigan, BCBA, and your CE host for Behavior is Biological, Healing is Cultural CEU Series, powered by Symbol.
And I'm Rashida Vieira, the fertility behaviorist, and I'm excited to co-host this important series with Ashley.
This CEU series brings together powerful voices at the intersection of behavior analysis, reproductive health, and culturally responsive care.
Together, we're spotlighting speakers who are bridging disciplines and leading change, sharing tools that move us beyond compliance-based models and towards autonomy, dignity, and quality and care.
You'll gain fresh perspectives, actionable insights, and CEUs that not only meet BACB standards, but also expand your practice in meaningful ways.
So if you're ready to join the conversation and be a part of the change, register today.
And let's grow together. So during my studies, as being an African American, a Black woman, did not see many that looked like me. During my studies, all my professors, there was only one professor I had that was African American, and she actually was my African American psychology professor. And knowing that in order for me to teach university or college level, I needed to have a graduate level degree. So whatever program I was going to go into, I knew that I needed to, pursue it even longer. And I knew I wanted to do something that was helping professions. I knew I wanted to do something that was more developmentally focused. So when I learned more about ABA, I was like, this is amazing. This is like, things that are kind of like sparking like my light bulb in my head as far as all the things that I enjoyed during my psychology studies. And wanted to focus more on something that was, within a subspecialty of psychology. So I ended up, going further with the ABA side of things and realized this was what I was meant to do.
So it sounds like your psych degree inspired sort of all this. What was it about this degree that made you, and why did you even go into psych in the first place?
So I actually took a psychology class in high school. My senior year, I took a psychology class, and I think it was an elective actually. And
Wow.
I, it was crazy because I didn't go into college with that as being my major. I was a nursing major at first. I went into early childhood education, birth through 5. That was like my major when I switched from nursing. And then I was a bio major at one point, worked in the pharmacy, during college, and
Wow, cool.
realized I didn't want to do anything scientific that way, like, having to study organic chemistry or any of the chemistry like classes or any additional biology classes. So I went from biology to psychology. So originally it was a bio major, psychology minor, and then I was like, I can't do science. This is not for me. Like, this is too tough. I only love statistics. I only love, the science out of like the human science. So I ended up landing in psychology, which is a science as well. And after taking some psychology courses during my first 2 years, I realized this was probably my favorite classes that I enjoyed. Learning more about the cognitive behavioral science, learning more about, the brain, learning more about, just the human development, as far as the psychology focus. And that was what I really fell in love with and knew I wanted to study something further within the psychology realm.
And so when you first got your first gig in ABA, was
Mhm.
that working with autistic kids? And so how did you kind of come upon doing that kind of work in the first place? Why did you take that job?
Yeah, so obviously you have to have some fieldwork experience, in order to become a BCBA. I went into, school as far as being in an ABA program, but the final like thing of pursuing was a certification in behavior analysis, being a BCBA. So I had to have fieldwork hours, and the easiest position that I found was finding a ABA, therapist gig. And after I started school, I had met like other, cohort members that were already working in the field of ABA. And a few of them basically was like, oh, my company is working on finding some people to, work for the company. I can, refer you. So then I was able to get a referral at my first position. And then I started working there when I finally moved to LA, because LA, I started school like a month, or I started school and I moved to LA a month later. So I technically didn't even start working as a therapist until I was maybe 6 weeks into the program.
Well, okay, so you don't have the typical kind of story that I hear from a lot of BCBAs and even PhD folk. It's usually they're in university and they need a job, and it's the only thing around there that's paying, or they've got a family member, or they worked at a summer camp and
Yep.
saw some kids and kind of went that route. But it sounds like you kind of got really into psych in your undergrad and sort of learned about behavior analysis a bit there, and just wanted to keep learning about behavior analysis. This has nothing to do with working with autistic kids. You just want to learn about behavior analysis and get a degree in that, and then eventually teach that to other folks. And it was the board certified behavior analyst credential
Uh-huh.
that sparked you getting a job doing ABA in the field. So
Exactly.
that's an odd sort of order of things.
Yeah, and I guess it was more of like introspection in a sense because I dealt with some psychological trauma growing up. My mom was in the military. I had like I had, issues as far as being a product of divorced parents. And I ended up realizing that I had like some psychological trauma and wanted to learn more about myself and also
Yeah.
like others as far as mental health and why people act the way they act. So it really was like I'm really into, the psychology of people
Mm.
and also of animals. Like I really enjoy animals. So I think there was some experimental analysis that was going on as well. I took a primate psychology class in undergrad and, I was really intrigued with the behavior of individuals. And that's really what kind of like, led me into that direction.
It reminds me of a lesson I learned that I have failed at in today's interview. I had Dr. Karina Jimenez Gomez on the podcast with a couple other
Uh-huh.
folks and asked her how she got into ABA. And she said, I didn't get into ABA. I got into behavior analysis. And there's a difference. And she started in the field in kind of in a similar path and was kind of more on the experimental side. And I keep forgetting that behavior analysis is more than ABA, and people get into it for sort of a wide variety of reasons.
Yep.
So how did you sort of get to, you were doing your master's and then was it sort of, were you doing a master's degree or were you sort of in a PhD program that got you a master's degree? Like what was the sort of trajectory there?
Yeah, so I did a master's degree and at the Chicago School of Professional Psych at that time, their master's degree were only research focused, like you only was able to do a thesis.
Yep.
Within the second year, they added on like an option to do an advanced research project instead of doing like a thesis. But I stuck with doing a thesis because I knew I wanted to go further as far as doctoral studies and needing to have a thesis already completed. So I already knew I had to do something dealing with, research. Going into my second semester of my first year is when we started to really focus on that and then figured out what I wanted to do. I ended up doing a study that was on precision teaching and focusing on staff meds and learning with employees at the company, new employees that were exposed to ABA and them learning definitions, using multiple exemplars, multiple resources and stuff. So that was actually what I studied for my thesis. So I kind of like fell into a whole different like area subspecialty versus like autism, obviously.
Mm-hmm.
So did a little bit of precision teaching for a little bit and then um, moved further working in ABA just, as a product of where I work. Because that's the primary area that, that pays.
Mm-hmm. Mm-hmm. And so tell me about the PhD journey then. And sort of,
Yeah.
first off, kind of like how long sort of after the master's degree and what made you sort of choose the school that you did and then sort of what the project and so on.
Yeah. So I ended up going back to the Chicago school.
Yeah.
Not only because I already had experience going there, but I was able to receive like a discount from being an alumna.
Perfect.
So I was like, this is perfect. I didn't need to have like a GRE or any type of like, testing like scores for that. And I really started quickly afterwards. I finished school like, at the end of summer. I started my doctoral program by the following January.
Wow.
So I started quickly. I wasn't even a BCBA yet, like, and I started my doctoral program.
Wow.
So shortly thereafter, and realized this was really meant for me because I learned more about ABA. I learned more about behavior analysis and all the different subspecialties, and really found or realized that this was more of a passion, like for myself, and all different facets in different areas. And I was able to learn about all the different things and study like subspecialty areas that I always was able to read about from the BACB's website, but then I was able to learn more about them and study them within my coursework, and also like from mentorship and guidance from my professors that were there. It did take me a while as far as the overall journey because I, I had multiple kids. Had one kid at the end of my master's program, so she was a baby when I like one when I started my doctoral program, and then we ended up having our twins a couple years later. But during that journey, the pandemic, hit. So my whole doctoral experience took longer than I originally expected. But I mean, they always say like, as long as it's finished. So that was always my goal, was just finishing. And I'm glad and grateful that I finally have finished it. And as far as my dissertation research, it was focused on acceptance and commitment training and behavioral parent training for parents of children that were diagnosed with selective eating, or not necessarily diagnosed, but they were experiencing selective eating like behaviors from between 2 and 5 years old, mainly because of the avoidance of them being diagnosed with AFRID, or avoidant food restricted intake disorder. And this was a passion from that because my oldest was a picky eater. And I implemented some different types of interventions with her, and that sparked the interest, and then a blending of acceptance and commitment therapy. From taking some courses and learning more about it during my doctoral studies, I was like, well, for one, a lot of the parents deal with burnout and issues with their psychological flexibility. And this is probably one of the huge barriers with families, dealing with kids that have selective eating or picky eating, because they're just giving them what they want. They're trying to avoid that burnout. They're trying to just provide them with whatever food. And that was what I was like, this is my topic right here. This is what I'm going to lead with, and figure it out from there. And was luckily able to be under the advisement of two professors that actually studied ACT, more intensively. One person actually did a parent training study as well. So I think everything kind of like worked all together in the end. So I'm very grateful for that.
And so tell me a little bit more about sort of this whole sort of food selectivity thing, and kind of what are sort of some of the common problems and kind of
Mhm.
themes, and a little more on this AFRID and what that means.
Yeah. So my main purpose of my study was evaluating the effectiveness of an integrated parent training model that combined acceptance and commitment training and behavioral parent training to address the selective eating. It was done through telehealth, primarily because, during the pandemic, that was like the easiest modality for any type of interventions or studies in order to reach many people versus them being within like my own community. And it was to address their food acceptance and also the parents' flexibility. From my own experience with my child being a picky eater, and also like my own experience as a kid, I was a picky eater as well. Um, Knowing that selective eating affects 2 to 5% of children under the age of 5. And after the age of 5, they are at risk and typically diagnosed with AFRID, which is a DSM diagnosis.
Okay.
Can be stemmed from sensory issues. It can be stemmed from psychosocial issues, environmental factors, hence parents. That was mainly what my focus was, the environmental factors. And then overall parenting practices, as well as like parenting stress, can also, grow more of that selective eating. There has been evidence-based practices and evidence-based interventions. There's different like programs that offer it as well. But from my research, there was not many that really focused on the parents, mainly focus on the children. And so that was what I wanted to mainly focus on and target within the parents, delivering those strategies and that, those interventions to their child in more of a coaching
Yep.
modality. And my main goals were to increase the psychological flexibility in the parents, to improve the child's selective eating, and then also see if there was any, improvements of their eating over time. I mean, there were some good findings. I guess from my research also, I don't know like if you're familiar with obviously the baby foods and the um Gerber.
I'm not a parent, so I
So
don't know
like,
anything.
there's baby foods that are served in jars, and
Right?
there's like, it was a huge marketing thing that happened like in the early
Mm.
like 19 like hundreds. I can't remember. It was like 1950s, 1960s, whenever like the Gerber brand was like,
Right. Yep.
originally released, and kids used to eat like regularly before the age of 1. Like salads were introduced as early as like 4 months, 6 months, but it still was a thing that they were being introduced to those salads. They were just being introduced in like more of a pureed salad versus like them eating, foods that were regular foods that people, should give them their kids.
Mm-hmm.
And that was really, what I was getting at is a lot of times the kids, especially children on the spectrum, they have texture aversions when it comes to foods. They have, sensitivities to certain things, and they have sometimes gag reflexes because the way that they, are exposed to foods before they're 1 can sometimes hinder how they eat after the age of 1. And then also, AFRID can be diagnosed typically around the age of 6, but selective eating is really set in stone like around the age of 18 months, which is when they really have like a learning history of eating certain foods, right? So the more exposure, the more textures and everything that is, being presented, the better early on. And that was really what we were getting at is like the participants that I had, a lot of them were only, eating pureed foods and had texture aversions and things of that nature. So it was more of like, I don't want them to gag. I don't want them like, I want them to eat
Sure.
something that I know they're gonna eat because this is something I know they eat. So then it came down to that. And
Okay.
also from like my experience as a clinician, I had clients that, were experiencing some picky and selective eating, and they also had like the same similar experiences due to how they were presented foods early on.
Hmm. I want to dig into your study shortly, but I just have a few questions sort of about. So first, with this sort of food selectivity, you talk about you're saying picky eating, food selectivity, AFRID. What's sort of the difference?
So AFRID is the DSM diagnosis, and that is the avoidant food restricted intake disorder. And that's when they have less than like 20 foods in their repertoire that they're eating, and they have a restricted diet when it comes to different textures. And selective eating is pretty much the same thing, except for it's before the age of 6. So that was the primary reason why my study was focusing on the ages of 2 to 5 before they get to that risk of being, a diagnosis of AFRID. So, I mean, there's like tons of research that's out there on AFRID and on selective
Yeah,
eating,
yeah.
picky eating. I mean, even the names itself, like there are differences as far as like you calling them picky eating and then also calling them selective. So you can be selective in what you want to eat, but then you also can be picky and not want those certain things. Like have history of eating those things, but you're being picky about wanting them. And that's that was my firsthand experience with my own kid is like she had a history of eating certain things, but over time, she had a preference of what she wanted to eat. And that's the same thing that typically happens with our clients is that they end up having a preference of what they want to eat and want to eat the same things. They're used to that sameness, if that makes sense.
And you talk about kind of a lot of this stuff getting set in stone around the first year. Is this stuff and it sounds like maybe Gerber was a big part of the problem. Is this stuff preventable? Could if parents were really thoughtful from sort of the moment the child was born in that sort of first 6 months
Yeah,
or a year, could they
absolutely.
prevent a lot of this stuff?
Yeah. And that was like my plan and what I did like personally with my next set of children, my twins, we didn't do any baby food. We did baby led weaning, and they don't have any type of picky or selective eating to this day. They're 4 years old and they eat a huge variety of foods, things that their older sister doesn't even like. And we started them early on with baby led weaning in the
And what's that?
actual like baby led weaning.
Hmm.
So basically, you just present them the same food that you would eat,
Hmm.
based off of like what they are able to eat. So if it's something
Hmm.
that's a soft texture, you're giving them like, a mashed up banana, but like it's not a jar of mashed up banana. It's actual banana mashed up, and then
Got it.
gradually increasing the texture and the size of it to the point where they're able to learn how to eat it themselves versus you spoon feeding it to them, out of a jar.
Wow. Interesting.
And
Okay.
that's always my recommendation, like friends or even I've had some clients that are like, less than 2 or around 2. Like that's typically like the modality that we go as far as like working on food acceptance of certain things, is exposing them to as many things as possible and working on improving their overall like food repertoire in the baby-led weaning modality, like allowing them to eat certain things and allow them to be able to prefer what they want to eat, but
Yep.
also like provide it to them on having them like a preferred food also within the array of what they do have a history of eating. And it actually was stemmed from, I don't know if I have it around me, but like there's this book called Broccoli Boot Camp. And it's actually a book that is written for parents. And it goes through like all the different strategies that you can implement with your child, like as far as getting them to eat more foods. And that's actually one of the like main resources and materials that was used. So, it was more of me coaching those parents and using that resource. And it was actually written by a BCBA, doctoral level. And yeah. I actually use it on myself first before I like implemented it with some others.
Yeah. So part of this would certainly, from the preventative side of things, the parents would also then need to be probably eating a variety of foods themselves, and that's probably part of the problem
Modeling
as
was one
well.
of the areas.
Yeah, if you're a parent that doesn't eat a whole lot of different foods, then your child's not gonna eat a whole lot of different foods, and it's
Yep.
just gonna continue that sort of cycle. Okay, so you're obviously working with folks that have passed that 1 year mark, and now we're having sort of food selectivity issues. Tell me about sort of what were the questions you were trying to answer in your study?
Yeah, so there was, does an act-based behavioral parent training intervention increase psychological flexibility in parents? The second area was, does the act behavioral parent training intervention improve children's selective eating behaviors? And then the third question was, were there improvements in children's eating behaviors that sustain over time? Because it was like extended study over multiple weeks. Versus like a one, stop shop. We actually like focus on coaching and like working on their eating behaviors over a course of 8 to 12 weeks. I mean, really great if I was to follow up on it. Did not include that, but that's something that I would probably do in a future study. But those were the main research questions. Within the first question was on increasing psychological flexibility in parents. I used multiple, materials that were embedded into the intervention. So they were doing a user experience survey weekly and daily. So there were some things that they had to do on a weekly basis, such as doing a valued living questionnaire. There was also a comp act survey that they had to do. And then they also had to do, once they were in the coaching phase, they had to do a act diary. So they do a daily diary as well as a weekly diary. So I was mainly looking at like, did their psychological flexibility improve over time? And then I had a pre and post test. So this is where they were leveled at, and then the post test as far as what they were leveled at later on. I then the actual within the actual where is it? I'm trying to think. As far as improving the selective eating behaviors, we had to focus on the psychological flexibility of the parents first. So they went through like a brief like ACT training over the course of 3 weeks. So it was like 3 different setups, and then working on behavioral strategies and also like on learning more about ACT and being able to incorporate some of those mindfulness practices and some committed action into their life. And then during the coaching phase, which was after that training phase, we, checked in on, where they are as far as what their committed action goals were, where they were at as far as implementing the interventions and strategies that they were using or that they picked from the Broccoli Bootcamp book. And then also providing me with the recorded observation of them implementing that strategy with their kid, and also like, me taking a count of how many bites they were accepting compared to what they accepted at the pre-test.
So tell me a little bit about who was in your study, how many folks, and how'd you find them?
Yeah, so that's actually one of my limitations. I ended up recruiting five. Five was my
Mm,
goal. I ended up
mm,
with two.
wow.
Primarily, yeah, like primarily because of the time that was, had to be committed for. And with and I feel like it was mainly time. The time that they had to be committed for 12 weeks was a lot. There was actually two parents that dropped out
Mm,
due to not being able to commit to that that amount of time. That actually was like a
yeah.
committed action issue right there. It's like it wasn't that important
Mm,
from my observation. I ended up with two parents in the long run. One of the parents actually became non-responsive. They started the study, and then by the time we got to the training phase, they became
mm,
non-responsive.
mm,
And I think that also was a limitation as well because I believe they were living out of the country, so the
mm.
time zones was like maybe off
Sure.
at the times that I was available to meet, but they
Mm,
didn't want to they didn't want to like provide me with the the location where they were.
yeah, yeah,
But based
yeah.
off of when they like scheduled, it was like a different time zone out of the country.
Gotcha.
I feel like that's might be reason why. Don't know the specifics, but that is definitely what I gathered from that. But I ended up being two parents that actually started and finished the study,
Mm,
and that was a limitation as far as the attrition that was experienced. And they were both actually parents that had children because it wasn't a requirement to have a child on with a autism diagnosis, but they actually ended up being parents that had children that were diagnosed with
mm,
autism. So they both had been within ABA services, but never had any type of implementation or interventions for food selectivity or for picky eating.
mm, mm,
So this was all new to them, and they were both like fairly new to ABA. So I think it was also like a really good thing for them because they were still experiencing some of the things when it comes to having a child now with a diagnosis.
mm,
So I felt like the psychological flexibility part of things was like very important for them in the long.
mm, mm. So that piece, the psychological flexibility, is sort of about. You said it was kind of about reducing burnout for these parents. Why were these parents burnt out? What was causing the burnout?
Their kids not eating.
Mm,
A lot of things actually. I was mainly focused on like the things dealing with, what the study was about, but there were, burnout as far as one of the parents being, I mean, she wasn't a single parent, but like she was kind of operating as a single parent, having to navigate all of the therapies, having to navigate, a child being sick, in daycare and having to pack lunch and then the kid not eating it. So I think that was, impacting her overall experience with, just parenting her child.
mm,
And then even during the time, I think it was a time where this parent I know for sure lived local
mm,
and we had a flooding situation and their home was flooded. So like that impacted like her being able to commit to the study for like 2 weeks, like where she wasn't
wow.
able to respond to certain things because they were navigating that life, environmental stressor.
Mm-hmm.
So just things like that. But I think from the training that she did experience, her psychological flexibility still improved and
Yes.
she was able to navigate the situation in a better way than she probably would have if she had not received that training.
Mm, mm,
But and then the other parent was like having to navigate, ABA in itself, having a younger kid that also, was a baby and having to deal with both of them, and then the kid, having behaviors and not wanting to eat anything and just wanting to eat the same things and having
mm,
to make their meal and then make the kid's meal, separate,
mm,
same stuff.
mm.
So that was like something that they were trying to get out of. It's like
Yeah,
oh, I want the kid to eat the same thing they were eating is what their
yeah,
goal
yeah,
was.
yeah,
So that was mainly what both of them experienced in a nutshell as far as the reason why they wanted to like join the study.
yeah. That probably got expensive for them too, sort of having to buy sort of separate meals for the kids every time
Hmm.
and all that
Yeah.
kind of thing.
Yeah.
So what was the ACT intervention? What were they doing in that sort of brief period?
Yeah, so in the ACT intervention, we actually did some metaphors with, some visuals that they actually like was able to watch. The a brief mindfulness like practices that we started off each session and then, it was me going through the different components of the hexaflex providing them with different examples of those, and then also going over some of the behaviors that sometimes are displayed when children are engaging in selective eating, going through some of the different practices and interventions that were a part of like the broccoli boot camp and what modeling looks like, what is, providing them with snacks throughout the day, because you want to like provide some type of motivation of eating.
Yeah,
And
yeah.
one of the parents actually would like give the kid food anytime they wanted it. And it was really hard for them to, eliminate that grazing,
Mm.
So that was one of the things we talked about. So them learning things about that, learning things about the act, and then learning things about, what that behavioral parent training was all about.
So how do things end up for these two parents?
Yeah, so both parents' psychological flexibility improved. One of the kiddos only improved like slightly when it came to food acceptance, and I think I ended up having to refer them because I think it was a little bit more intensive as far as like swallowing and things needing some more intensive like feeding therapy for. The other kiddo improved so much when it came to food acceptance. I mean, the graph is beautiful for that kiddo. And by the end, he was literally like independently eating things off his plate, and they were able to eat meals together. So that was like
Wow,
one
amazing.
of the highlights for that mom and dad too. That was also involved. So it was really good for that one.
So it sounds like this was a difficult study. I mean, to do is because of sort of all these extenuating factors. It's COVID. It was probably a big one. Telehealth. People dropping out, and family circumstances, and so on and so forth.
Yeah.
What were This was sort of your first bigger study. You did do a thesis, but what were kind of some of the lessons learned in terms of research kind of going forward from doing this dissertation for you?
Yeah. I mean, I feel like the biggest lesson was like having more patience. I mean, I was on a timeline to finish, but having the availability to have time to do a longer study would probably have been better for me because I was limited on how many I was able to recruit. After I recruited 5, if anyone dropped out, I couldn't recruit anymore. So I think having like more of a longitudinal like option and being able to recruit more individuals would have gave me more better results. And then also, having it maybe in a focus group, the parents originally it was supposed to be like a group training and both of them their times just did not align. So we ended up having to do an individual training. So then meeting with them separately versus together. And I think that would have been better because then them being together and providing information about their barriers and their like issues that they were dealing with and having another parent dealing with some of the same things, it would have been more of like a parent focus group. So that's one thing that I was also thinking about, but at that time I was like I already got my RP approval done, so I have to like I have to stick to what I already have planned. That was one of the barriers. And then I think another barrier that I experienced was the so I use this app that's called XPWell, and it's a user experience. Like, and it was a lot as far as figuring it out, like having to put in all the surveys, having to
Yep.
like time it to where it sent the notification to the parent, and also like for them to upload recordings or whatever it may be. One of the parents who was not primary English speaking, I think had a
Mm,
lot of issues when it came to the app. So there was a lot of glitches that they experienced. And then, sometimes I might have had it like open for a certain window. If they missed that window, I had to like reopen the window. So it was a lot of like, having to do some IT back work on the back end.
wow.
So I had to do a lot of fixing, and I think that was another huge barrier I had. Maybe finding another like solution to gather their responses as far as the surveys, and also another way for them to upload recordings. So I think time was like the biggest issue as far as that goes.
You managed. You finished. You got your dissertation done, defended, and your doctor now. So what do you do? What's sort of the post doctoral Ashley up to? What
Uh,
you
What am I
into?
not up
Yeah.
to?
Second secret word is mentor.
So I still currently work as, a director of training and development focusing on leadership and supervision and mentorship. I oversee a fieldwork supervision program. That's my primary joy is training and mentoring, so I run that program for Achievements ABA. And then with my own consulting company, I also do private supervision. And I love taking on like trainees that are, wanting to explore things other than autism, especially. So I have someone that's in the speech realm, I have someone that's in like the business realm, I have another person that's in education. And I really enjoy like being able to tap out into other things other than just ABA. Aside from my leadership role, I also hold a small caseload of my own kiddos that I oversee. And I feel like, I don't know, I feel like I always will have like a small caseload because I feel like it keeps me up to date and being able to practice my craft as far as that. And I work part time as a faculty member at Kennesaw State University here in Georgia and working under the department chair, Dr. Denise Ross, who's also a BCBA.
Nice.
So I fell into that last year and I'm going into my second year, like in just a couple weeks with semester starting, teaching educators. And I realized this was, it was meant to be, because now I'm focusing on training educators and being able to work with inclusive, students and being able to, train them outside of that autism sector, outside of that clinical side of things. And I really love that too, teaching PBIS, positive behavior intervention supports. And mainly because a lot of times I feel like just from attending IEP meetings and different like school consulting meetings, sometimes those professionals don't necessarily know how to implement an FBA or develop a BIP. And that's what we focus on in that class that I teach is developing a BIP the right way versus like, just throwing in some interventions and not actually having like a huge foundation and an analysis of the individual's behavior. So I really love that. And we are also working on a grant funded project that I work on as a fellow, which is using some like augmented reality, virtual reality.
Wow.
We have an avatar lab at Kennesaw State, and the avatar lab is primarily for the inclusive education, the education department, for the students who are educators or future educators working on basically in the avatar lab, working on like a mock class and being able to deliver like curriculum and like respond to students.
Wow,
And
cool.
yeah, it's really, really cool. I love it. And the project that we're doing for the grant funded project is working with educators on doing an FBA and a BIP as well. So they get to serve a student, they get to collect some data, they get to go back and develop a behavior intervention plan and then come back to the lab and then be able to implement that BIP. So it's really neat, like with the avatar, like, being able to respond and implement certain behaviors that we can like set forth a certain amount of time. So that's really cool. I
Super
really love
cool.
that, project that we're working on.
Yeah, so training educators, so is this like a teacher training program that you work in
Yeah,
or?
so it's our Masters of Arts in Teaching. So we
Mm,
have two programs, actually three programs. We have a Master's in Arts of Teaching, we have a Master's in Ed, and then we also have an EDS, or a Specialist in Education, under the
mm,
department that I'm working in. The class that I primarily teach is in the Masters of Arts in Teaching program, but we also have like some plans and initiatives that we're working on. Because they do have a autism certificate and they also have a dyslexia certificate. So the dyslexia certificate is typically embedded within both the MED and the MAT program, or you can do the autism certificate within those programs. But we're working on some things to try to like modify that autism certificate and having some more of a focus of ABA.
right on. I heard say EDS. So do you have like school psych students too?
No, no,
Mm,
specialists in education. So that's typically for like, anyone that is wanting to go into leadership within, the public school or the school sector, principals, stuff like that. So no, just a specialist in education.
mm.
They do have a psychology program at the school, but our program is for inclusive education.
Yeah, yeah, yeah.
or
And
SPED is what it used to be
you get to
called.
work with Dr. Ross, and she must be like an amazing mentor to have. What's it like having a Dr. Ross as a
Amazing.
mentor?
Like, that's my sister. Like, she talks about sister circles, and that she's really like I'm in her sister circle, and I really enjoy that. She has become my mentor by default, especially because I met her a couple years ago, actually, helping her out with a project she was doing for the Journal of Social and Behavior Issues. So I kind of met her by that, and then she moved to Georgia and got that position as a department chair and was looking for BCBAs, or someone that has a BCBA experience to assist with some of the courses they have in the program,
Hmm.
and reached out to me. And I'm like, well, I've been having this passion of being a professor. Like, this worked out perfectly. So it's been great as far as her mentorship and helping me like become a better professor and also a better instructor of being able to support the students. And it's different because like dealing with my clients and dealing with like the supervisees and trainees is one way, but dealing with students and
Hmm.
like that side of things is like a lot of leniency has to be given, and
Hmm.
a lot of leniency as far as like submissions. And I'm just like, you're late on this. Like, I don't know about giving you a pass or an extension,
Hmm.
but we have to kind of like provide that, just as a university. So I really like it's the
Hmm.
one thing I've had to learn is like I can't be the same way in both positions, like clinical and like, university level. So that's one thing I've also like learned and experienced and have been grateful for her advice. I just met with her this morning, so she's been great.
That's awesome. You talked about doing like PBIS and that stuff. Were you into PBIS before this role, or like were you familiar with that realm? Like, what's your sort of
Yeah.
experience there? And
Yeah, so when I lived I didn't live in DC. When I lived in Maryland, I used to work in DC at a charter school. And when I was
okay.
working in that charter school, I worked as an academic intervention fellow,
Hmm.
and then shortly thereafter was able to get promoted into a position as an early childhood special education teacher. So I was primarily responsible for our pre-K 3 all the way up to kindergarten students, and would do some small groups and basically observations and push-ins with some of the classrooms, and also like support as like a substitute teacher. So that's kind of where I got exposed to that. And then also with some reading literacy, which is another thing that I've been working on, for my own consulting company and with Dr. Ross.
Hmm.
So it kind of like, was an area that I was exposed to just by default from living in DC and working in that position, and fell back into it from being able to work with her.
Hmm. Right on. Right on. You also talk about doing a lot of supervision and really loving doing supervision. So what is it about supervision that brings so much passion for you to do that kind of work?
Training the next generation. That's, training the next generation of individuals. I mean, like, I think from my original experience as far as mentorship and being able to have like really good, strong foundation as far as having a good, strong mentor during my master's studies, and also like partly during my doctoral studies, I didn't have a great mentor. I had a lot of, figuring it out on my own and learning things on my own. Even with my own fieldwork experience hours, like I had a lot of ups and downs when it came down to that. And before I became a BCBA, I worked as a clinical supervisor for a company and would train. This was around the same time that the RPT certification kind of like came about, and fell in love with training our BTs into RBTs, and doing their competency assessments. And then also like once I became a BCBA, started like assisting the company with fieldwork supervision, and it just became like something that I was recommended to do. And then I realized I'm good at it and I really enjoy doing it, and I get a lot of great like compliments out of like my trainees, and love providing them with as many resources as possible, because I'm
Hmm.
like, always create your folder of all these different resources and all these different things, especially like during your program. Whatever you learn in that class is going to help you in the long run. Like, I still have
Hmm.
books from my master's program that I still use. I have
Sure.
books from my doctoral studies. I mean, even with the classes that I took in my doctoral studies, I feel like there is always opportunity for me to be able to mentor them on those different things that I learned. And then
Hmm.
it kind of keeps me fresh in those things as
Hmm.
well, because, with them learning more about things and listening to podcasts, or, attending any CEUs, they can come to me with questions that they have at any
Hmm.
time. So I think mentorship and supervision has been like just my trade, you know.
Mm. And do you have sort of kind of an approach to supervision that you think is kind of your like? Well, how do you approach supervision? And are you like a curriculum kind of person? Are you sort of just guided by the supervisee? I mean, and also sort of a related question because I'm guessing the answer is probably no to maybe the first question because you supervise folks that are sort of in so many different sort of realms when it comes to ABA, and so kind of what's that all look like?
Yeah, so primarily, like those that are working in the ABA sector, I do utilize curriculums because it's more focused. Since they're already working in a clinical setting, they need to be able to become more experienced in that setting, especially working with
Mm,
their clients and
sure.
collaborating with their BCBAs. But at the same time, I also kind of take their lead and collaborate with them about things that they do have a passion for and things that they want to like explore further, even past certification. So it becomes more of a twofold. I'm dealing with curriculum and I'm also dealing with them like leading based off of what they're wanting to learn more about.
Mm,
And then
mm.
as far as like my private trainees, it's a cohesive thing based off of their area of specialty and then also kind of like tapping into like how can we integrate like behavior analysis into that.
And so, what does that look like when you're mentoring someone who's in an area that you haven't worked in?
So it depends.
Mm,
It depends because, like, most of the trainings I take, I've worked in it in a certain way. I mean,
mm,
speech therapist, I've worked in early intervention,
mm.
working collaboratively with the speech therapist
Yeah,
in 2 different locations. So I've worked with speech therapists before closely, and then also in education, I've worked closely with that, and in business, OBM has been, like, my jam just being in
mm,
leadership. So
mm,
I feel like those are like my top areas that I really enjoy, like verbal behavior, when it comes to the speech, that's a really great,
mm,
area of
mm,
specialty that I've enjoyed. I mean, working with my early learners and like, utilizing the VB
mm.
assessment is probably one of my favorite assessments because of how much I enjoy like verbal behavior, and Skinner's book for verbal behavior. So I think if it's something that I don't really think that I'm equipped with, I wouldn't take them on.
Yeah,
I would
yeah, yeah.
refer them to someone else, or I would find someone that can be able to collaborate with me to better train me in that area to help them. Luckily, I do have a network where I can be able to, ask questions,
Yeah,
receive some formalized training or some mentorship in those areas because I'm always about learning. I'm always, for CEUs, I'm always like, signing up for mentoring things. So if it's not something I don't know already, I will find out.
right on, right on. And in addition to sort of all these great roles that you have, I know that you also do some volunteer, some service work. Can you tell me about that side of your life?
Yes. Probably one of my greatest passions is serving, to my ability. So I do serve on in multiple like avenues. And I think it's just been something I've been doing since I was in grade school. I mean, like I've been like, in different clubs and different like volunteer capacities. I've tutored, for friends' children or well, not my friends' children, but my mom's friends' children and stuff like that. And then when I was at Georgia State, I was a part of an organization that was something that we started at Georgia State. And then when I went back into my master's program, I kind of continued on that path is like volunteering for different like chapters and different groups.
Mm,
And when we moved back to Georgia, I attended the Georgia ABA conference with the company I worked for like a couple years later and met so many people that I now consider friends now because a lot of them are still a part of my life. And that was years ago. And I joined a subspecialty committee, which was their
mm,
DEI committee.
mm.
Before it was an actual committee, it was a subspecial like committee. And this was before I had my twin. So I became a part of that committee years ago. And then as I was able to get back into the game, I realized I want to get back into it. I want to become more of a leader for our state and be able to support individuals everywhere. Accepted a role as far as my nomination for co VP of DEI at that time. So I did that for a year. and then got nominated again the following year, and then did a co-VP position of membership and finance. That was for a year, and now I'm in the 2-year role as co-VP of marketing and communications. And I think it's helped me like create a lot of like, I guess you can say, associates and networking from like being able to network with not just my board members that are a part of the board, but also like being a contact for others like within our state. So I think that's helped me out a lot. And then aside from that role, I was reached out to from Capella University to join their advisory board
Wow.
for their School of Social and Behavioral Sciences, mainly for ABA side of things, because of like, I
Sure.
guess my experience in ABA, and then also like, at Achievements ABA, we have a partnership with Capella, and we have a lot of students that go there.
Yeah.
So I kind of like built a partnership we have with them. And one of the main people that is a part of the advisory board, basically nominated me to be a part of the board. And I think that's also, shed light on just the higher ed side of things when it comes to master's programs and different programs and what they're offering. And then I see a little bit of how things work in that side of things from being on that board. And then probably like my greatest ability is being able to serve at our church. We have a extremely large like following and attendance at our church within 3 services, and they built a state of the art like a kids church facility. So we have a lot of kids that come through there, and we also have kids that have special needs that also come through there. And a lot of times like parents don't feel comfortable with bringing their kids, so we have exceptional leaders. So I'm one of those exceptional leaders, and I'm a captain basically. So I oversee the other exceptional leaders. I took on that position because we have kids that, are an inclusive model in a sense, but then they have also needs. They have sensory needs. They have like needs as far as like, being able to take a moment away from the loudness in those rooms or whatever it may be. So during that time when I'm serving, it's me, being able to like push into different like age groups, and then also be able to like work one-on-one with certain kids who are needing a little bit more support. And that's probably one of my biggest ones. And then another one I deal with is my daughter's Girl Scout troop. That one is just like by default as a parent, like I just fell into that as a leader because nobody else would really do it. None of the other
Wow.
parents want to do it, and like being a leader already, I'm like, okay, I'll help out as much as I can. So I have enjoyed that. This going into my 4th year being a troop leader for her Girl Scouts.
Wow. And so when do you get time for the family and the twins and
Yeah.
sort of,
Weekends are like our time. I mean, obviously, like, church is very big in our family. Like my husband's also like a part of our church, and he serves in multiple ways as well. Sundays are like Sunday mornings are all devoted to church. And the rest of the weekend, it's us like doing things with the kids, going to places, whatever it may be. Even like weekdays, sometimes in the evenings, like tonight, my husband would go to Wednesday night service or another night. So a lot of times I'll have like my trainees wanting to meet like in the evenings or doing group meetings during the evenings. I'm just like, I'm not available that night. Like, we have plans or like sports. Like, so it's a lot of blocking off my time. It's
Yeah.
a lot of like chunking, as far as my schedule, and allowing my kids to still be able to experience extracurriculars is very important. And also us like being able to go like to the movies or going to like birthday parties and stuff. So we do a lot of planning for our schedule. Like my husband was just talking about it this morning. Like I'm trying to like request off for certain days all the way into like Thanksgiving, all the way to like next year.
Yeah.
He's just like, I gotta block off all these days. And I'm just like, I'm just taking it day by day by day is my jam. But him, he's like, we gotta put this in the calendar. We gotta put this in the calendar. And I'm just like, oh, okay. Let me block off my time, make sure I don't like have anything scheduled during that time. So it's a lot of coordinating and a lot of like collaborating, across all of us. And even when my mom is going on vacations, I'm like, okay, I can't have you as a person that can babysit. So I need to make sure I'm not doing anything this weekend. So it's a lot of that.
Wow. Well, it sounds like you do a really good job setting boundaries, and that's really important, and making family a priority and making service a
Yes.
priority. Yeah.
Yes, and I learned that actually from integrating acceptance and commitment therapy or
Mm,
training on myself when I first started years ago and implementing mindfulness practices. Like we do mindfulness practices as a family, we do them individually. My husband, my kids, they all know, how to do meditation and mindfulness. Like we have mindfulness cards and things like that. And it was because like before the pandemic hit and like during the time that I was going through IVF with my twins, I was experiencing burnout, with clients I had, and
mm,
then I was also learning about ACT at the same time, and I was just like, this is what's my problem. My problem is like I'm getting stuck on my past. I'm getting stuck in like those unwanted thoughts and
mm,
not,
mm,
being able to implement certain things on myself. So then eventually it became to the point where I had to start doing it on a daily basis. I actually took a mindfulness and ABA class during my doctoral program.
yeah,
And I think that helped out tremendously being able to like set those boundaries, being able to implement
mm,
psychological flexibility, like, domains for myself to ensure that I'm able to maintain my sanity.
yeah. Circling back to supervision for a second, just based on all the stuff you just said, one thing I think a lot of young behavior analysts struggle with is the burnout and things like imposter syndrome and kind of all these big issues.
Perfectionism.
What are some of the things you kind of do in supervision to sort of help mitigate that, to sort of help folks avoid or at least be able to ride some of those waves as they go on? Are you
Yeah.
using a lot of ACT? Is that part of it? Or
Yes. Using a lot of ACT, they probably know that if I'm going to talk to you about it at least once a week in our group meeting or in our individual meeting, but they know how big of a strong like person I am when it comes to those things. So
mm,
they're learning about that from like month one of their fieldwork experience.
mm,
And then I also utilize a curriculum that talks about all of those pivotal behaviors that they need to basically establish for themselves in order to be a better clinician. And I feel like it's
mm,
not just stuff for behavior analysis, but it's things for
mm,
just any human service profession.
mm,
It's implementing pivotal behaviors like, strong communication skills, being able to, have better time management, having self management,
mm,
being able to engage in some self care practices, and all those things we're talking about from the beginning.
mm,
And I'm like, you're going to experience burnout if you don't start doing this. You're going to experience burnout if we don't like, work on our schedule. You're working over
mm,
40 hours a week. When are you
mm,
working on like your schoolwork? When are you working on your fieldwork hours?
mhm,
And they get to the point where they found out, later on that they're burned out because they're
mm.
working 50 hours a week. They're in
Yep.
school full time. They're taking 3 classes at the same time. And then they also are working on weekends or doing whatever it may be. And I'm just like,
Mhm,
you're going to be burnt out. And then those people who are burnt out, they typically take longer to finish their hours because they
mhm,
have no time to do anything. So it's always like, having to weigh your pros and cons, like what's most important. Like,
mm,
what are those things that you have for goals for yourself? So I'll typically like provide them with a trainee interest and goal survey that they have to like complete when they first start out with fieldwork supervision with me. And we're developing goals from day one. We're developing goals that they need to like basically have as far as objectives, short-term and long-term objectives.
mm,
And then what are the things that you're going to be implementing to meet those goals over
mm,
time? What is a 3-month goal? What is a 6-month? What is a 1-year goal that we're going to meet? And I think once they have those things set up, things just kind of like, flow easily. And
mm,
then they're able to like implement those strategies for themselves. And they are implementing having a really useful planner and having being on top of their schedule
mm,
because that's also highly important, I think, when it comes to working 8 to 7, but then like you don't have any time for doing anything because all you want to do is go to bed when you get home.
mm, mm,
So
mm,
listening to podcasts while you're driving to your sessions. We
mm,
integrate that. Listening to an audiobook about something.
mm,
Finding the times that you can be able to implement things, during your downtime because I feel like immersing yourself in these things is important. And putting aside things like listening to music or listening to, nothing at all or the
mm,
radio, you don't need that in your life. If you want to like be a better clinician and not be burnt out, you have to learn the ways and you have to learn all
mhm.
the different like strategies and practices for yourself to be able to implement it for your clients and also train the parents on it as well.
Oh, that's awesome. So, what are some of the what are some of your longer term goals? and your 6-month goals and your 3-month goals? What's happening for you?
Ooh, that's a good question. So I actually am so I have a 3-month goal of finishing a curriculum book for supervision that I'm working on. And that's also going to be in collaboration with a CEU series that I'm doing, the 8-hour supervision course that people typically have to have when they, become a BCBA.
Yeah.
So working on that, hopefully to release in the fall.
The third secret word is leader.
And then 6-month goal is going on a great vacation with my kids and my husband. We want to go up the country somewhere together. So that's more of a personal family goal that we have. Nice. And then probably in the next year, I am working on opening up a learning center.
Wow. Amazing. And all the while, keep teaching and keep doing all those great things. Yeah.
I want it to run itself though.
Yeah, absolutely. Right on. Cool. Dr. Ashley Carrigan, thanks for coming on the podcast. This was awesome learning about you.
Awesome. Thank you, Ben.
Yeah, stoked. Please check out these 2 related episodes of Behavior Speak. Episode 97, Culturally Responsive Telehealth and Behavior Analysis with Kimberly Woolery. And episode 85, Online ACT Matrix Parent Training for Japanese Mothers with Distress with Dr. Yuki Kurumaya. And lastly, you can check out my short conversation with Dr. Carrigan live from the 2023 Black Applied Behavior Analyst Conference in Detroit in Road to BlackCon 2024 mini episode number 6. You can find links to all these episodes and more in the show notes. You can find us on Instagram and TikTok and subscribe to our YouTube page at Behavior Speak. And if you enjoyed this episode, please leave us a review on Apple Podcasts or Spotify.